Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Hi, I'm Caitlin Tivnan, and thanks for watching Health Watch. If you are like most people right now, all eyes are on your favorite football teams. You're paying very close attention to who's on the field and who is on the bench because of an injury. So we're here to talk to Dr. Michael Brown about one of the most common injuries you hear about in sports, and that's an injury to the ACL. And let's just start by asking the most common question. Can you explain exactly what is the ACL and why does it get so frequently injured?
Well, the ACL is a ligament in your knee that prevents abnormal rotation. So when you tear your ACL, you have a hard time doing twisting, turning, cutting, and pivoting maneuvers like a lot of sports activities. And it's a very common injury with contact athletes or even non-contact athletes.
And how does it get torn? Is torn the actual word you usually hear? Do you tear the ACL? There's nothing else that can happen to it.
It tears from the ligament attaches to the bone, both your bones and your knee, and an abnormal twist or a violent hit like some of the professional football players can cause an actual tear or rupture.
It sounds very painful. Is that a very difficult injury to work through?
It is. It can be very painful initially. But usually after the initial injury, it's not the most painful thing, and some people don't even realize they've torn it.
When this does happen, about how long does it take for the recovery process for someone to be able to get back out on the field and be active again?
Well, it's a long recovery period. Oftentimes the patient or player has to do physical therapy before surgery to get their knee in good shape, to work on their motion and bringing the swelling down, and then after the surgery it takes 6 to 9 months and sometimes a year to fully recover.
We're kind of talking about professional athletes because it's that time of year, but is this an injury that's actually common amongst other active individuals?
It's more common in girls than in guys, and we don't know the reason for that. A lot of research has been done, but it's very common in female athletes, very common in soccer players, basketball players, volleyball players. And it usually involves a non-contact injury where a simple twist or changing directions causes the injury, much more common than a hit in football.
Are there steps that someone can take to try to prevent having this injury happen to them?
The best thing you can do to try to avoid the injury is to be in good condition, to have good strong legs and avoid fatigue. But unfortunately a lot of times it just happens.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page. I'm Caitlin Tivnan. Stay healthy.